Good afternoon, everyone, and thank you for joining today's webinar sponsored by NewGen Software. I'm Sonali Nigam, and I'll be introducing today's webinar and presenter. Now, before we get started, I'd like to take a moment to go over a few housekeeping items. First, you should be able to see a title slide on your screen. If you're having any problems viewing the webinar or encounter any technical difficulties, please use your chat box to send a question directly to me, the host, and I'll try to help you. Second, I'd like to explain how we are handling questions today. Due to the number of attendees, participant lines are muted. If you'd like to submit a question for our presenter, please do so using the question box on the right side of your screen. We'll monitor the questions for anything urgent, but we also want to respect everyone's time and also our presenter. So we will try to keep the webinar within the allotted time frame. In addition, if your question is not able to be answered today, please do feel free to contact our presenter, Saras Agrawal, with any additional questions. Also, this webinar will be recorded, and we will send you a link with the video so you can view it again. Now, a few words about our presenter. Saras Agrawal is Director of Healthcare Products and Solutions at NewGen Software. He has 15 years of experience in architecting and consulting solutions over case management, BPM, ECM, and CCM frameworks. Over the past decade, Saras has focused on helping U.S. healthcare payers bring their business processes into the age of digital and mobile. With that, I will hand off to Saras.
Thank you. Thank you very much, Sonali, and good morning and good afternoon to everyone. And thank you for joining in for this webinar. The agenda for this webinar would be a new healthcare landscape, CCM trends, CCM challenges in healthcare, talking about the overview, and in the end, talking about few of the business benefits that a health plan may get by automating CCM. So moving on to a new healthcare landscape, we are seeing that U.S. healthcare market is in the midst of a transformation. And some of the key trends that we see every week by talking to different health plans, by talking to analysts, is the new customer with the new digital expectations. Over 16 million new insurance customers are entering in the U.S. health plan market. Primarily in the past it was due to Affordable Care Act reform, and out of which 32% of all applicants are under the age of 35, looking for companies to communicate with them according to their preferences. Affordable Care Act drives the market shift towards business to consumer rather than B2B. The ACA has transformed the health insurance market space with the introduction of health insurance exchanges. More than 11 million members, new and existing buyers, are purchasing coverage through new online market space. With that said, with the new president and new governance, we don't know how things would shape up in the next 6 months with regards to ACA. We'll see that. Merger and acquisitions, we see large corporations acquiring other companies to get more market share, enter into different markets, and gain more expertise. Major consolidation to name is the Aetna acquisition of Humana, deal value $33 million. New distribution channels, healthcare payers are looking for new distribution channels for selling health plans other than the state and federal exchanges. So these are few of the key trends that we wanted to present out of many that is going on. Next, we wanted to talk about the omni-channel. So let me explain. Omni-channel is a cross-channel business model that companies uses to increase the customer experience. The approach has verticals in healthcare, government, telecommunication, including channels such as physical location, frequently asked question web pages, social media, mobile application, telecommunications, so on and so forth. Companies uses omni-channel content that a customer values the ability to be in a constant contact with company through multiple avenues at the same time. And we see that the 4 imperatives which is leading to this is our mobile shift. We now see that every consumer, whether wants everything to be in the smart apps of the mobile or tablet. They do not want to move towards even to the websites. Digital disruptions, to name is Uber. Uber do not hire or own any driver or car, but in turn the revenue is more than total revenue of enterprise or Avis or budget. So digital disruption is some of the very key imperative that is driving to omnichannel. Big data into market insight. Now we see that the organization cannot only rely on the enterprise data lake that we have for analytic analysis, but now for predictive analysis they have to look for the external data, the consumer behavior in the social media or other data, how consumers are behaving. So we are seeing that the organization have started now hiring data scientists for predictive data analysis. Moving on to some of the key customer communication challenges or drivers for CCM is the adhering to regulatory compliances, delivering timely, accurate and personalized communication across multiple channels, managing digital expectations of new customer, managing high volume of communication with consistent messaging, simplify complex document to facilitate better readability and understanding, time-consuming and error-prone customer communication process owing to a lot of manual interventions, controlling operational cost, dealing with aging legacy systems. So there are several drivers oblique challenges for implementing CCM. These are the key which we wanted to present, and all our experiences basis talking to various health plan and the research organizations. We have introduced 2-3 polls between the webinar, and we would like to have participants view on this. So this is the first poll, and I would introduce that in front of you now, and I would like the participants to please participate on it. How would you describe your organization's current use of paper print for customer communications? And the options are completely paper-based, mostly paper-based, and some digital, about 50-50, half paper and half digital, mostly digital but some paper-based, and completely digital. So I can see the results coming in with a mixed feedback. So what I see is that most of the participants have replied that the most common answer is mostly digital but some paper based, and this is in line with what our research says. I'll wait for just a few more seconds to complete the poll, but yes, 50% of the people are saying that mostly digital but some paper based. Moving on from the poll to back to the webinar, and I hope you can see my new screen. Key regulations around member communication. Now, while dealing with health plans, we often see that there are several hundreds and hundreds of regulations which needs to be taken care while communicating with member and provider. Few we will name is the communication regarding the enrollment materials. Plan sponsor should communicate the annual notice of change or evidence of coverage, pharmacy directory, provider directory, membership ID cards to new enrollee no later than 10 calendar days from receipt of CMS confirmation of enrollment by the last day of the month prior to effective date, whichever occurs first. Communication regarding termination of contract with provider and pharmacy. Plan sponsor must communicate a notice of termination to a contracted provider at least 30 days before termination effective date to all members who regularly use these provider and pharmacy services. All outbound communication need to be documented. The mailing of the enrollment verification letter are expected to be completed no later than 15 calendar days of the plan sponsor's receipt of the enrollment request. Also, plan sponsor must document outbound enrollment verification activities. Provision of notice to beneficiary regarding formulary changes. Part D plan must communicate at least 60 days notice to beneficiary before removing Part D drug from the Part D formulary. So there are hundreds and hundreds of regulations around member communication. I named few of them, and with the managing all these regulations in manual world of correspondence is very difficult. And all these lead to a need for a automated customer communication management. Some of the compliance and regulatory concerns that healthcare industry is seeing due to a manual way of handling the correspondences are, we have mentioned few of them. The risk of fines for non-compliant communication around protected health information is on the rise. If discovered, a single non-compliant message could lead to a penalty of up to $1.5 million. Even if corrected within 30 days, HIPAA violations can attract a fine of $10,000. HIPAA violation penalties can even include imprisonment of 2 to 10 years for knowingly misusing individually identifiable health information. In 2015, the approximate number of healthcare companies who have received CMS sanctions or suspension is about 35%, and 62% of these companies have received CMS fine of $250,000. In 2016, fines and sanctions related to HIPAA and high-tech law have tailed as high as $6.5 million for a single violations. Here I have listed few examples that 5.5 million settlement from Advocate Health, 3.4 million assessment against Signet. So these are few of the examples that we see every day. Moving on, some of the key trends in customer communication management that we see are rapid adoption of a web as point of sale. A growing number of customers are buying and managing insurance online. This necessitates an agile cross-functional communication platform that can help customer transact and communicate through any communication channel of their choice at any time. Need for an interactive and cohesive engagement. Customers are demanding greater responsiveness and transparency in communication, irrespective of communication channel, especially in the areas such as claim settlement and policy holder services. Growth of mobility. Mobility has evolved from mere claim settlement text messages to end-to-end customer experience on a mobile platform. Customers have gravitated towards mobile customer experience and expect the same service that are offered by a portal. Personalized service in return for customer loyalty. Customers expect personalized service in exchange of their loyalty. Customers' query processing and request management process segments have therefore been the first movers to the CCM platform. Effectiveness of targeted communication. Past experience indicates that over 90% of the customers respond to the targeted communications. Some of the budget facts that we wanted to present here in front of our audience is that the United States Census Bureau estimates that over 31% of healthcare spending is dedicated to processing the paperwork, which definitely includes correspondences, and definitely there are few percentage which is not correspondences. For healthcare payers, outbound constitutes communication represents one of the large operational expense item in their administrative budget. Most payers are overspending on their annual print and fulfillment budget for mere member communication by 10 to 15%. For health plans with 250,000 members, for example, cutting 15% overspend factors to $1 million yearly saving. The use of CCM solution will reduce traditional communication cost, increase effectiveness, and improve efficiency of health plans. This brings us to our second poll. I will launch it right now. As we are moving towards CCM, understanding it, the poll is what is a CCM, and the options are: I'm here to learn this, it's a headache pill, a technology that prevents health plans from talking to their customers, a way to improve member experience and compliances. So I would like our members, audiences to please rate on it, and I can see the results coming in. Okay, so yeah, this is what we normally see the results are in most of the CCM webinars that we do on a quarterly basis. So a way to improve member experience and compliances, this is the most primary objective of implementing CCM. And so 75% of the audience replied that, and 25% says I am here to learn about this, and definitely we will do our level best to explain CCM in the simplest way. Moving back to our presentation. I hope audience can now see my deck instead of the poll. So CCM as an overview, what is CCM? It's a strategy to improve the creation, delivery, storage, retrieval of outbound communication, including those for claims, enrollment, billing, complaints, customer service, legal, finance, HR, and every department of an organization is impacted by the correspondences. Improve communications with primarily member, provider, and plan sponsors. Supported communication, for example, members, welcome kits, ID cards, EOBs, claim correspondences, provided directories, wellness assessments, determination letters for their complaints, so on and so forth. Providers, provider EOBs, reporting, determinations of their complaints, and plan sponsor client reviews. So these are few of the examples that we have mentioned here, and in your organization the list is endless. Next is the CCM components and workflow. A very important slide that we wanted to discuss with you all is, if you will see that on the left hand side we have said that all the departments of an organization is using and correspondences. So marketing needs to correspond, operations, whether it's a member operations, provider operations, claims operations, they need correspondences. Finance need correspondences, HR need correspondences, customer service need correspondences, and they correspond with the members and providers. So if you see on the right side of the presentation, you will see that there are multiple ways through which communication are done, whether it's a web presentment, whether it is email, whether it is print and mail, social media, mobile, so on and so forth. And in between is the implementation of a CCM solution. So the data for correspondences can come from the internal databases, which could be the core claim system or system or provider database, finance systems, or the data could also come from an outside external databases like social media, portal, e-form, email request, so on and so forth. And then in between is the rendering part, which is the customer communication management. So when you implement CCM, all the standard templates are designed, approved, and then archived in the repository so that they can be used multiple times in different ways of communication. Now, there are three common ways of correspondences. It could be batch mode, it could be interactive, or it could be on demand. And if I speak little about all these three is, for example, the ID card, all the members enrolled today in the evening, the ID card and the welcome letters of all these members would be auto-generated and mailed to the member. Example of batch operations. Interactive correspondence could be while a case investigator is investigating a complaint filed by the member, in the end, while taking a decision, they want to generate a correspondence for the member, letting them know what decisions have been taken by them for their complaints. So we call them interactive. And definitely most important is the on-demand, where we see most of the members and providers and customers are going is, you go to a web portal or you go to a website or you go to a smart app of an health plan and you say, please give me my EOB or please give me my claim settlement, or you demand anything in real time, a correspondence is generated and it is in front of you. That is on demand. So in this whole picture, on demand, interactive, and batch operations is implemented. The organization uses the archived template to generate the correspondence with the real-time data from the system, and when correspondences are generated, they are delivered using multiple methods, whether it is email, whether it is mail, whether it is fax or text message or mobility based. Moving on from the CCM component and workflow is, here is a small representation of a member appeal in a claim process. The dotted line shows the updated flow after the CCM implementation. A member files a complaint to a health plan and there needs to be an acknowledgement letter based on state or federal regulation. If some information is missing, a missing information letter has to be sent, and definitely after, in the end, a determination letter has to be sent. So let's say a manual environment wherein a member information is collected, a case is prepared, and in the end somebody would manually print an acknowledgement letter and send it. During investigation it is found that some information is missing. For example, it is a appeal filed by an AOR, but AOR is not on the file. You need to send an AOR signature letter that is again sent in the downstream process. However, in the dotted flow, what we are seeing or what we are representing here is that as soon as a member files a complaint, it hits the system and the acknowledgement letter is automatically generated and sent to the member, because acknowledgement is very standard letter. It does not need any personalization or some extra wordings. While investigating a case, if based on the rules, if additional information is required or information is missing, system automatically recognizes that and a correspondence is generated and sent to the member. So what we are showing here, it brings efficiency, it manages compliances, it reduces the human intervention in some of the automated steps. Moving on, the current versus future CCM state, we will say that in current state, organizations have multiple systems to solve the same problem because these systems have been deployed in different period of time. Different systems have different capabilities. No consistent approach to e-delivery, very expensive and lengthy release systems, and reactive communication model. But future state, what we wanted to show here is reduce costly IT releases and empower business users to create and manage customer communication, consolidate all customer communication capability under one tool, cutting down expenses by eliminating other tools, move towards e-delivery, email, chat, text messages, web pages, etc. Integrate CCM capabilities with ECM for inbound and outbound correspondences, and proactive communication to enhance customer member and provider experiences. Every department, as we discussed earlier, needs CCM, marketing in compliance with CMS guidelines, promotional materials, brochures, leaflets circulated to physicians, provider or third-party entities, enrollee newsletter that include any plan-specific information, example information about benefit, premium, copay, deductibles, operations department, enrollment needed, confirmation letter, rejection letter, product needed, care plan letters, ID cards, billing needed, billing statement, billing coupons, termination, cancellation notice, customer service needed for final demand letter, welcome letter, future member handbooks, administration needs it, membership communication including membership rules, agreements, handbooks, membership activities, example, materials on rules involving non-payment of premium, confirmation of enrollment or disenrollment, customer service representative needs it, and which is most important is greener applications are now being leveraged to derive costs and to achieve process optimization. Insurers are migrating processes such as premium payment, policy administration, and bill generation to greener applications. And here I have mentioned 4 departments, but in every organization there are 10 to 15 departments which uses or which are impacted by the CCM. Moving on to the very important business benefits that we always hear from health plans and research organizations and from the market. Design and deliver targeted communication to promote healthier behaviors such as preventive screening, avoiding unnecessary emergency room visits, improve disease management and therapy adherence that reduces healthcare cost and claims, create easily and efficiently create complex communication packages like welcome kit, member handbook, annual notice of change, simplify the process to create, manage and produce notices, EOBs letters, policy statements, evidence of coverage, pharmacy directory, provider directory, enrollee newsletter and any ad hoc enrollee communication. Create customer-centric personalized messaging, personalized wellness message, very important. Create customized and interactive communication for a variety of delivery channels and mobile devices. Streamline process and reduce operational cost. Ensure regulatory compliances. Our value proposition to health plans, NewGen value proposition, scalable to multiple line of business. You implement CCM maybe to start with one line of business. As organization grows, the same ecosystem can be used for multiple line of business. Endure customer loyalty, always compliant. It's a unified platform to do all kind of communications. Reduce the cost of communication transactions. Ease of integration with enterprise solutions, because CCM would be interacting with most of the core and non-core applications of your organization, because in any system correspondence is required. My last poll which I wanted to present, I will put it in front of it right now. Okay, so what is the biggest challenge of your organization faces in improving the customer communication? Integrating any new technology with existing systems, overall cost and providing ROI, siloed organization structure, no priority from top management, or it is something else. Okay, so I can see a mixed response. 50% says integrating any new technology with existing system, and overall cost and providing ROI. So overall cost and providing ROI, we often find it's a business concern, and integrating any new technology with existing system, we normally see it's a IT concern. And both of them are a very, very valid concerns that are put forward by any organization to any CCM vendor. And as and when we get a chance to work with any organization, we will present an easy way how to overcome these concerns. The CCM applications that NewGen provide has platform independent APIs and pipes built in, which helps in interfacing with your health plan current ecosystem without bringing turbulence into any of the existing systems. And overall cost and providing ROI, we have seen, I would not name and quote a lot of figures and name here, but we have seen that by working with the health plan, within first year, the return on investment is achieved by the health plans on CCM. So moving on to some of the ending slides of my presentation, which I wanted to show is now, since we have seen healthcare trends, CCM challenges, oblique drivers, what is CCM? We will talk few minutes about NewGen. So it's a global company, 1,300 plus customers across 61 countries. We have approximately 1,800 plus employees globally, with 240 partners oblique resellers of our products. It's a very heavy development shop, 40 patents across 20 plus verticals. All the products that NewGen produces, BPM, ECM, CCM, and mobility framework, are organic, which means it has been developed in-house and not purchased and being sold, which is a very important information for any organizations to know while we work with them. It's a global company with office locations across the globe. In Washington, we have our headquarters for Americas. We have Healthcare Center of Excellence in Florida. We have offices in London, Dubai, India, so on and so forth. The research firms and organizations highly vote us, like in all NewGen products are in the Gartner report, Enterprise Content Management in MQ 2016, positioned in Intelligent Business Process Management Suite Magic Quadrant 2016, positioned in Customer Communication Management MQ Quadrant 2015. So Gartner, Forrester's, all these research firms continuously help us enhance our product, and they rate the company and the product good. Some of the key North America logos that we wanted to present here quickly, with whom we work for our products: Wellcare, Horizon, Riverside, Becton Dickinson, Johnson & Johnson. This brings me to the end of the presentation, and I would be more than happy to answer the questions which audience may have.
Okay, thank you so much, Sarah. That was a very informative presentation. And now it's time for some audience Q&A. So I'll kick things off with a question from Patricia. And the question is, what is the approximate time required to implement a CCM project? Suppose you are in a health plan that has approximately 500,000 members.
Okay, very good question. So let's say, for example, if you have a 500,000 member, our experience says that the implementation may take 4 to 6 months. 4 months if your organization IT department already have a lot of interfaces pre-built with which NewGen CCM can interface with to pull and push the data. And 6 months if interface do not exist, and even if they start writing the interfaces when we start the project, even in that scenario, 6 months would be a high level timeline to complete the project. So to summarize, 4 to 6 months is a timeline to implement a CCM project in a health plan having 500,000 members.
Okay, great. Thank you. Another question we have is, what kind of IT involvement is needed to implement a CCM project?
Okay, another very good and important question is that one, we need infrastructure help from the infra team if it's an on-premise solution, which means we need IT help to get the servers in place. And another which is very important is that we need IT to provide us the interfaces, how to connect to your core claim system to bring member, provider, claim and data, how to connect to your system to bring authorization data, how to connect to your financial system to bring the financial data to print on the correspondences. So we need IT help to bring or to provide or to develop these interfaces so that the CCM can interact with these applications and work properly.
Okay, thank you, Saras. I believe we have one last question from the audience, and that question is, can NewGen CCM generate correspondence in multiple languages?
Yes, NewGen. So since NewGen is a global company, NewGen CCM is being used in America, Africa, Dubai, Middle East, APAC. We are capable of generating correspondences in all languages. Now talking about North America healthcare industry, if based on the state and federal regulation for some line of business, if correspondences has to be generated in the primary language of the member, and the primary language of the member is not English, system automatically generates the correspondences in the non-English language.
Okay, great. Thank you so much, Saras. Looks like we are at the end of our presentation for today. So thank you everyone so much for joining us, and thank you, Saras, for taking the time to present. Just a reminder that this webinar has been recorded, so you will receive an email with a link to the video and you can view it again. Thanks again for joining, everyone. Have a great day. Goodbye.